Now other elbow injuries are overuse injuries, and these can occur in baseball players and throwers. It usually occurs with repetitive movement of the elbow and stretching of the ligaments. Particularly the most problematic or most common one is the ulnar collateral ligament, and this is usually seen in throwers. And this is where this ligament is actually disrupted, and the elbow becomes weak, and when the elbow becomes weak, and this medial side becomes weak, these bones open up and separate because the stabilizer is gone. So if your livelihood is throwing for a living, this is something you have to have diagnosed and treated appropriately. And a lot of times that can require a Tommy John reconstruction if you depend on throwing as your livelihood. If you're a professional athlete, a collegiate athlete, a high school player that has a potential career in throwing in college, this might be something that you need to have reconstructed, so please see an orthopedic specialist to get an appropriate recommendation and evaluation. Now you can't have stretching of that ligament or even a sprain of that ligament, and that oftentimes can be treated without surgery, just using a brace and conservative measures. Now the other elbow, which is the lateral collateral ligament, goes on the outside of the elbow. When that ligament is disrupted, which can also occur with a traumatic injury, such as an elbow dislocation that just didn't heal right, and this bone, the radial head here, can pop out of joint because these ligaments here are no longer there. And so when you supinate or rotate, you actually see this bone pop out of joint and you have to pop it back in. That's called posterolateral rotatory instability, and that does need to be evaluated by an orthopedic specialist to make the diagnosis. And oftentimes, depending on your age and activity level, that can require reconstruction or surgery.